Dental fillings are the most common procedure in dentistry that helps to fill the hole or cavity that has formed inside teeth. Dental cavities are the result of tooth decay. It is a consequence of plaque accumulation over the teeth. Plaque is a slick composed of bacteria, which is formed on teeth after sugar and starches found in the foods we consume combine with the bacteria present inside our mouth. Bacteria produce acids that damages the enamel of teeth, causing the development of dental cavities. When a cavity goes untreated, it will increase in size and extend to the interior of the teeth, including the pulp in which the nerves as well as blood vessels are situated. The result could be inflammation, pain, and possibly tooth loss. The need for a dental filling to avoid further decay and to restore the aesthetics and function that the teeth have. There are many types of dental fillings that are available, such as amalgam, silver fillings, and composite, tooth-colored fillings filled with gold, as well as ceramic fillings. The type of filling depends on the area and size of the dental cavity in addition to the preferences of the patient. The procedure to get the dental filling procedure is straightforward and usually accomplished in just one trip to the dentist. The dentist first numbs the region around the tooth by using local anesthetic to make sure patients are comfortable during the procedure. When the tooth is completely in a state of numbness and the dentist has removed the decayed area of the tooth by using an instrument for dental drilling, the dental cavity will be cleaned and sterilized in order to avoid the tooth from more decay. When the cavity is created, then the dentist will fill it with the desired filling material. Then, the dentist will make it into the contours of natural tooth. The filled-in material will be set by using a particular laser or chemical procedure. When the filling is set installed, then the dentist will modify it as necessary for a healthy tooth and the smoothness of the surface. After receiving a dental filling, it's important to ensure good oral hygiene in order to stop the possibility of further dental decay. That means flossing and brushing often, eating a nutritious diet with a low amount of sugar and starches, and going to your dentist on a regular basis for routine examinations and cleanings. When properly maintained, dental fillings can be retained for years to help protect your tooth from harm. To conclude, a dental filling is a vital procedure to fix tooth decay and stop future decay of the teeth. The procedure helps in restoring the functionality and appearance of the tooth in addition to preventing the development of infection and pain. Through advances in dental technology, it can be a quick and non-invasive procedure that could dramatically improve your oral health. If you've got a decay or tooth pain, it's crucial to consult your dentist as soon as possible in order to stop more damage to your tooth.